Course name: Bipolar Disorder. Misconceptions about bipolarism explained. We might have come a long way in recent years in reducing the stigma around mental health conditions, but there's still a long way to go, especially when it comes to properly understanding certain conditions like the bipolar disorder. Although awareness campaigns regarding the bipolar disorder seem to be getting a lot of attention everywhere, such as in the news, in the movies, in schools, and on public speaking platforms, it is sad that misunderstandings about this condition prevail just like they did a decade ago. Bipolarism is difficult to diagnose, and it is often confused with other mental illnesses. Also, because mania is the hallmark of bipolarism, the depressive episodes sometimes get overlooked. In order to clear the air, Abudo has listed some common misconceptions about bipolarism which need to be eradicated. Here are a few myths and facts so you can arm yourself with knowledge and help end the stigma. Misconception number 1. Bipolarism is rare and has no forms. Firstly, the bipolar disorder affects 2 million adults in the United States alone. 1 in 5 Americans has a mental health condition, so it is not rare. Coming to the second part of the misconception, there are 2 types of primary bipolar diagnoses: bipolar 1 and bipolar 2. Also, everyone with a bipolar disorder will have different symptoms, all of different levels. Some people might only have a couple of bipolar episodes in their lifetime, while others might have more. Bipolarism is traditionally signified by depressive lows and manic highs. Type 1 is characterized by higher levels of mania and the existence of psychoses, so this is usually more severe than type 2. Misconception number 2. Bipolarism is a personality disorder. No way, it's not a personality disorder like a borderline personality disorder or antisocial personality disorder. It is instead a disorder that primarily affects moods. Misconception number 3. Anyone with mood swings has the bipolar disorder. Well, it may be a mood disorder, but it is not a case of simply having mood swings, which, let's be honest, we all get. We all experience good and bad moods from time to time, but for someone with bipolarism, mood changes are often more severe, varying from excitement and elation, known as mania, to depression and despair. Each mood may last several weeks, or there might be long stable periods. As with all mental health issues, mood changes should be taken seriously and not oversimplified or stigmatized as just mood swings. What is also damaging is when people use the word bipolar to describe a mood swing, similar to the way people have long used OCD to describe tidiness, when the condition is much more complex than that. The bipolar disorder is a mood disorder, but we don't have all the ups and downs with our moods constantly, and we don't all rapid cycle between moods either. To confuse mental health issues is ignorant and belittles the condition. Misconception number 4. Being too happy is one of the symptoms of bipolarism. The manic high symptom of the bipolar disorder doesn't equate to being really happy. It involves feeling constantly restless and an inability to feel calm. It can lead to delusional thoughts and reckless behavior that puts the person at risk of endangering themselves. Many people believe that all bipolar patients experience euphoric highs, but in reality, the manic phase can often express itself as overconfidence, irritability, or confusion. Misconception number 5. All bipolarism medication comes with bad side effects. As is the case with all other medications, some antidepressants can cause side effects too, but this is not the case with all antidepressant medications, and quite often it comes down to the individual or through a trial and error process to see which medication works best for you. Misconception number 6. The bipolar disorder keeps you from living a normal life. This, of course, is absolutely not true. Just like with any illness, if it's managed well and you have the right medication and care, you can lead a great, normal, regular life. People think you will not be able to work, achieve academically, have a family, or hold down a relationship. This misconception is false. The disorder affects everyone differently, and many do go on to achieve and be successful in what they want to do. That's not it. There's a whole world of misconceptions out there, but to fight them all, you need to educate yourself. Sign up at Abudo's online platform and get access to 15 plus health and wellness programs, including the bipolar disorder. What are you waiting for? Like, share, and subscribe.